Speaking of the next panel, a key factor in the new roadmap is for a contextualized but greater country approach and ownership. What does it look like and mean for Onco now that we have had a glimpse into the benefits, the opportunities of a regional approach? There's been all these great, points made about trust, about what strategy means, looking after the community and program managers. But it can all certainly inspire new collaborative approaches. This will be part of the focus in the next session, chaired by Professor Mamoun Homeida, President of the University of Medical Sciences and Technology in Khartoum, Sudan, and the former chair of the Technical Consultative Committee at APOC. Welcome, Mamoun. And to you, I would also say, keep an eye on the time. Thank you very much.
Thank you very much, Patricia, and I'm very pleased to be part of this important symposium, thanks to the task force and to Bruce, who put that book together and initiated this symposium. And it's very pleasing to see old friends, from all parts of the world who worked hard on onchocerciasis, and very pleasing to see them. They are keeping healthy, and some of them are even looking younger. So with that, I think I will go into this session, which is the last session, being disadvantaged of being the last session, but I hope it will be still refreshing. And it is implication of lessons learned for onchocerciasis elimination. Okay, although the lessons learned from onchocerciasis elimination can be generically used to other entities, I think an eye will be on onchocerciasis elimination. For one, I thought, or I wished that this symposium has been held very soon after APOC has ceased functioning, because then the lessons would have been fresh and the implications would have been more applied. And in the last 5 years, I think we have a gap now between APOC ceasing and now, and one wonders if these lessons are still valid and still, being used into elimination of onco and what is happening to that magnificent program. I think I will skip the slides because they are not going to show very well. I'm just going to throw some, reiterate some of the lessons which has been mentioned, very clearly mentioned and addressed by many of the speakers now. But I would like to ask questions for the panel to put on their presentation. One is the lessons learned is a science-driven program. We all agreed that from the stories told that this is a science-driven program from the time of the CDTI, from TDR, and then the lower crisis, which have been very well documented scientifically, and the TCC MEC guidelines, and later on, and then the RAP LAWA. All these are very good, high caliber science, and the social benefits of the ivermectin. Again, one of the major progresses which has been dealt with is the OncoSim. The mathematician went on board to give us a guide and a graph of how elimination can be achieved. And then the major science came, maybe, I don't think it's by chance, but it is there for us to pick, is the Mali and Senegal study. And these are important studies which has opened our eyes to the fact that elimination is possible, and it has been actually achieved almost without us being aware of it. So these are the lessons which I think are important. And then I think for the panel, I think we have to concentrate on the implication of using the community, of the African community. Scientists all over the world, maybe even Africa, have belittled the role of the community and the community-driven programs. But the African community have surprised us by how well it is organized, how well it can work, and the success that the community has led these programs. So I would like to see if we can really use the communities, the African communities, as it is structured today, into this program to strengthen it and to lengthen the life of the program. The partnership, we have already dealt with it. I think part of the success of the EPOC is that the partnership is international and national. True that the endemic countries have been given the lead and the ownership, okay? And the communities have been leading the program, but the strong outside partnership, the World Bank on one side, the NGOs and the WHO and the others are very strong. So the question is, can we as African countries, okay, and now we have the Eastern African countries economical tie and the Western African, can we get a program which is located and serving these communities in the spirit of EPOC program? Uh, thought about, run, and implement it. And then another point is obviously the regional nature of the program, and that African scientists, I think EPOC has succeeded because most of the scientists leading the management and science were Africans, dealing with an African disease and feeling the pride of eliminating onchocerciasis. So that is another way of the benefits of the regional partnership or the regional program. And I think I would just like to end with the fact that the management of EPOC has really thought of EPOC as a EPOC program as a university, because so many scientists have been trained in public health. The workshops have been dealt with, and the missions, the monitoring and evaluation. So many, I can recall, I've seen tens, if not hundreds of young scientists, African scientists, have been trained in this program to be public health officers. And I'm very pleased to see some of them are even at the very high level of ministerial health in Africa. I think there is a curriculum now on CDTI, and the methods learned or lessons learned from this are the basis of master's degree in public health in many African countries. I think I don't want to take much of the time, but these are just thoughts, okay, given and thrown to the panel, on which I'm very proud to be leading this expert panel of very well experienced workers. Mueli, you know, she's the director, Department of Control of Neglected Tropical Disease. She, in her own self, has been a high scientist, renowned scientist from Tanzania, and she has published quite a lot. Uchi Amazigo has been mentioned with these innovative ideas, and all of you know Uchi Amazigo as a former director, and then Mauricio from South America, whom I very glad to have known for so many years. And lastly, not least, but Gilbert. So with that, I think I would like to ask the first panelist, Muela, to give her thoughts about the implications of lessons learned from onchocerciasis elimination.
Thank you very much. And thank you very much, Mamoon, for the introduction. And let me first, like my colleagues, congratulate Bruce for this inspiring and timely book. And we thank you for your story of compassion, of collaboration and community. And just, you know, we are at a critical juncture in onchocerciasis globally. And what we had heard this afternoon just strengthens my belief that in order to realize our goals, NTD goals, we must harness the power of partnership. Now, I know Mamoon wanted us to look at the implications of the lessons learned from onchocerciasis elimination. And one of the key things that I think that you as a community will be very proud of is that we still have a good partnership for NTDs in general. So 2 years ago, we started working on the NTD roadmap for 2021-2030. And it's unbelievable how everyone came together, regardless of their diseases, regardless of the diseases that they worked on, regardless of the areas that they worked on. We were able to come together and come up with a really, really good roadmap, which has been co-created by all of us. And so this for me is a sign that we do have the good foundation of very good partnership, and it's taken the experience that Bruce has written about and all the other partners coming together to get to this point. So this is an evolution, and I think it's an evolution that will continue. And so something that we can learn from this and lessons learned is that partnership is important, and everyone has said that. The roadmap is built on shifts, on three important shifts, and the key one is about measuring, focusing on impact rather than process. And here is where your point about the science comes very clearly through, Mamoon. It's really important to ensure that we have good ways to keep the science going, to ensure that these programs continue to be built by good science. And I understand that, yes, while we have a very strong elimination goal, we have to understand that these diseases must be looked at in the context in the broader context of NTDs. So while, yes, we want to focus, and yes, these vertical programs have built the foundation of our disease-focused programs, they are also now, we need to also think about them more contextually in a horizontal way and look at this more broadly, and the depth and the breadth and the equity of the partnership we need is not only for onco work, but for all NTDs. And so these collaborations remain vital to our achievement of the 2030 targets as they were in the period leading up to 2020. So as we move to the next decade, we need to ensure that the progress on the ground properly reflects the needs on the field. And this means facilitating, upholding the principle of country ownership, which is something that has been brought about again and again. The importance of regional ownership, the importance of cross-country collaboration, the importance that once onchocerciasis does not know borders. So we have to, when we're talking about elimination, be clear that we have to have a regional approach to it, and as well as other NTDs as well. And so these are just a few points that I think we can take forward. I think the national elimination committees are a good gift to the NTD community, and I think we should use them well. So these are a few things which I think we can take forward. And in the interest of time, I will stop there.
Coming up next, Uche Amazigo, the former director of APOC. If you would like to take it away, Uche.
Now, as I said, thanks to Bruce, thanks to the task force, I'm going to talk about inter-country collaboration because the panel is on that. For me, the first important issue here is really inter-country movement by black flies versus inter-country collaboration of partners taming the lion's stare. That's what I took from Bruce's book. We say that black flies do not have passports, but I would like to say that black flies have passports stamped with oncoparasites from endemic areas for rapid migration to countries. This is the way I look at it. And Bruce also mentioned in the book that cross-border areas are the Achilles heel of a comprehensive elimination effort. I completely agree with him. So for me, this perhaps is one of the most important topics of this meeting, inter-country collaboration, because without this, there will be no elimination. I hope you agree with me. Now, the challenges, since for lack of time, there are quite a number of challenges, but I do know that operational research, as many speakers said this morning, can can help us deal with any of the challenges. But let me mention one of them, the transmission. We agree that transmission from hypoendemic areas will eventually disappear unless infection is reintroduced from nearby hyper and mesoendemic communities. This means that national programs need to deal with local transmission or imported ones. However, in the past few years, the question has always been, or the emphasis has been, on the goal of identifying all transmission foci in the hypoendemic areas. And I ask myself, is it possible to identify all the hypoendemic areas given the scarcity of funds for NTDs and serious migration, at least in West and Central African countries? So this is something I think the experts need to deal with operational research. Do we need to define all the areas, hypoendemic areas, or can we still implement? Yeah, so I have a few suggestions on the way forward. First, I think, as mentioned in the book by Bruce, there is need to revisit the 2011 advisory group report and re-examine the reasons this group placed so much emphasis on cross-border foci. And perhaps we can adopt some of the recommendations. Also, I'm very pleased with the roadmap, the World Health Roadmap, and I congratulate my sister Nwele. But I would also like her to look at like the Manu River Basin Project or collaboration that Simon Bush led, the Uganda DRC intercountry collaborations led by Tony Oketi and Tom Lakwo, and quite a number of them between OCP countries. Afro or WHO should share a revised, well-defined partnership and regional plan for inter-country collaboration if we want to move forward. We also have Professor Homeda, who taught us how to do cross-border collaboration in conflict areas. These are brains and experts that we have today. Please let us tap the resources from them and we will be able to move forward. On partnerships, Bruce Benton wrote, "The boy and the blind man are trusted partners, just as many individuals, organizations, governments have been trusted and battling the disease. We need a cohesive partnership backed by donors. We need to go back to partnership to succeed in taming the lion's stare. We cannot run away from a regional partnership, particularly in the area of inter-country collaboration. The partners need a forum to receive and discuss empirical data from national coordinators annually. And I think, Nwele, this falls on your plate. To create that partnership, and I think WHO, I would appeal to the MDP, the World Bank, and the World Health Organization to create that forum that is very much needed. And that forum was also mentioned by Catherine Marshall when she talked about the role of meetings. And Bruce emphasized it very well in his book. Publishing things on WHO website is not sufficient and does not take the place of meetings. Please, this, I think, are some of the points that we need to look at. Investing in entomological evaluation and the experts like Professor Daniel Boachi, Tony Oketi, Tom Lakwa, I have mentioned, and also applying social innovations and implementation research to answer some of the challenges we are facing on cross-border infections. Finally, I would like to emphasize on the need to harness community human resources to address the challenges of inter-country collaboration. And on that note, I think we need to present to the World Health Organization to consider a technique that quite a number of projects have used to involve communities recently in social innovation. And that technique is the listening, a listening technique. And that listening technique will allow national coordinators to collect data and information from the communities. They are called listening tours. And the data and information collected by national coordinators or interdisciplinary research teams, as you may want, will be sent back to either ESPIN or World Health Geneva, and that will help in designing viable strategies that will strengthen or at least help us to revitalize the collaboration, inter-country collaboration. You can remember that flies from Nigeria were disturbing Benin and sending the Republic of Benin efforts towards elimination back. Today, that is still happening. We have not, the dream of the Republic of Benin to achieve elimination will still be, in my opinion, far-fetched until Nigeria gets its acts together. Thank you very much. And thank you, Bruce, for inviting me.
Thank you very much, Uchi. That was very good. I think what you have stressed and what Muela has stressed is that this country by country or regional countries to work together, and elimination can never be achieved unless we do that, because I have calculated that there are at least over 10 or 15 foci that cross border. Okay, like Ethiopia, Sudan, and all the areas, Cameroon, Nigeria, and all the rest. And unless people come together into a real partnership, this is the real partnership, which stems from the countries themselves. I think this is, we need leadership, WHO leadership. And since Muela is there, I think the African unity can be invited, you know. The health secretary of the African Unity can be invited to promote this partnership, and unless we do it, we cannot move forward. With that, I think I would move to Mauricio to give his thoughts about this implication of lessons learned. Maybe he will highlight some of the lessons which from OEPA. Mauricio?
Thank you. I would like to thank the organizers of the symposium, the task force, for inviting me to participate representing the Carter Center's OEPA initiative, and want also to extend my congratulations to Bruce Benton for his book. The establishment of the OEPA's strategy of 2 times per year treatments originated from field studies carried out in Guatemala during the late 80s and early 90s by Collins and Kopp, showing that 2 years of treatment coverage above 85% blocked community transmission. This was the most important milestone for success. Later, more frequent treatments were added in the selected communities, only to accelerate transmission elimination. After OEPA's initiative advanced in several country programs through the years of high coverage treatment in hypo, meso, and hyperendemic communities, and became close to stop treatment, OEPA realized there were no specific WHO guidelines to stop treatment. That situation prompted President Carter to contact directly Director General Brundtland to ask for certification criteria for onco-elimination. As a result, a Geneva conference, as was mentioned by Frank, was convened in 2000 with participating representatives from Africa and the Americas, and the first guidelines were published in 2001. These guidelines were used to certify 3 of the first 4 countries in the Americas: Colombia in 2013, Ecuador in 2014, and Mexico in 2015. It is important to note that 2 times per year treatment approach eliminated transmission in Ecuador focus, which had an efficient vector, Simulian X-Seaward, showing vector transmission dynamics equivalent to damnosum, the main vector in Africa. Demonstrated a general belief the Americas elimination was possible due to the presence of less deficient vectors is not true. OEPA's partnership was articulated by the recognition of the highly trusted leadership brought by President Carter and the Carter Center by accepting to manage the initiative in 1996 after the River Blindness Foundation initial role. Accepting that responsibility by the Carter Center was essential to secure bringing an important variety of private donor funds. This, in addition to significant public funds contributions from endemic countries in response to several WHO PAHO resolutions calling to eliminate regional onco. As a result of all those private and public contributions to date, $185 million have been invested, showing an important funding distribution corresponding to 38% from the national countries, 29% from the different private donors through the Carter Center, supplemental to the national contribution, and 33% of in-kind donation of the magical Mectisan from Merck. Today, OEPA's private donor funds for the last mile are coming mainly from USAID Cooperation Agreement and a Merck grant, among other donors to whom we are deeply grateful. During the last mile of any disease eradication elimination program, according to previous experiences in the world, there are inevitable appearance of a variety of challenges. Some are technical and need to be addressed technically. Others are out of control to the programs, like the SARS-CoV-2 pandemic. Among the last category, additional to the pandemic, an important challenge common to both onco regions and already mentioned by Uchi are cross-border issues, difficult to approach and in need of significant inter-country collaboration to overcome any adverse political environment. The Yanomami focus cross-border between Brazil and Venezuela is a good example of. Less treatments are needed as compared to previous larger regional foci already eliminated, but requiring more funding to cover for the hard-reaching issues, where also community participation plays an important role through the health education, as well as greater level of political will for critical inter-country collaboration. This justifies the need of having a strong, long-committed partnership to last through the last mile in order to sustain required operational activities and evaluations until last treatment needed is completed and elimination is achieved. It is also important to point out OEPA's effort for cross-fertilization, bringing former directors from LCP and APO, Dr. Watan in 2000 and Dr. Seketeli in 2009, to participate in our annual IACO meetings, conference meeting. I participated in APOC's program managers meeting in Ouagadougou in 2013. Finally, for public health schools, OEPA's development history, based on a data-driven approach, can be found described in a serial of uninterrupted annual publications within the weekly epidemiological record since 1996. And I like to end my participation quoting our health vice president, Dr. Iyash. The work is worth it and it isn't finished. Thank you.
Well, thank you very much, Mauritius. That was very good, and you highlighted the experience from UEPA. I think our last panelist is Gilbert, and we are doing good for time, and we can have some questions. And I'm going back to Muela to tell us about the African Unity and what they have done about health collaborative programs. Gilbert is there.
Yes, thank you. And I'll be very short because I know we're over time and we need to finish off here shortly. So I'd just like to say When I saw this note that said we're going to talk about inter-country collaboration, I just wondered how many other conferences have we had on inter-country collaboration? And I'm sure it's triple digits at least. And it reminded me of this management saying that says, if we do things the same way we've always been doing things, we're going to get the same results that we're always getting. And so I've been a bit concerned that the reason we're not getting results is maybe we need to look at things somehow in a different way. And as Mahmoud said in the beginning, that we trust the community. The community has done a great job. It exceeded our expectations. They're wonderful at doing treatment in the community. However, if that community crosses the border, we don't trust them there. And I remember as a young doctor in Malawi that when we had problems with the focus across in Mozambique, we just rode our motorcycles across the border. And it reminds me that, people at the borders, they marry across the border, they go across the border to markets, they get buried on the other side of the border. People think borders are just artificial things that move back and forth, except when we're talking about how do we distribute treatment into these areas. And so I think this is a time that we need to have a new approach, and we need to get this approach by going to the border and looking at what's happening there and listening to people. And what are they telling us? And what can we do if we get the systems out of the way? And just to finish with a quotation from the father of quality improvement who said, when there's a problem, 20% of that time is going to be the people, but 80% of that time is going to be the process. So I think we need to look at the community, what works well at the communities on the border that allows them to work nicely across the border with each other, to go to the markets, to get married across the border, and what can we learn from that will help us to do our treatment across the borders and not try to add more digits to the inter-country collaboration meetings that don't seem to get us any place. So if all else fails, it's time to listen to the people. And I'll finish at that.
Thank you very much indeed. Is Mwele there? Could you elaborate on the effort by the African Unity?
So the African Union is developing a framework, an NTD, what they're calling a continental framework. The major thing with this framework is going to be predominantly around advocacy. But I think as we've been talking about this cross-country regional collaboration, I think it will be a good starting point, because it will definitely push for regional economic communities, for example, the East African community, the West African Health Organization, to start thinking about what they can do together in the context of NTDs. So this is looking at NTDs broadly. It's mainly from an advocacy perspective to get the actually head of state buy-in. But I think that the key thing here is that at some point, this will allow us to push more for this inter-country collaboration that we're talking about. And as Gil said, it's very important to start at the community level. It's really important. But at the same time, you need to look at both angles. You need to be looking at the community, but also you need that political will and buy-in, which Mark Rosenberg talked about earlier. Thank you.
Thank you very much. I'm saying this because I really have a concern now. South Sudan is an independent country, and we used to work on onchocerciasis elimination on both parts of Sudan. Uchi will know that very well. And now the traffic is going on, and I think we really need to sit down and put something in writing and something to be implemented. I hope it's not going to be another digit on Gilbert's number of meetings. I would like to pass it to Patricia. Amazigu would like to have some comments. Uchi?
Uche, very
Uchi,
quickly.
Yes.
Yeah, thank you very much. I just want to, very quickly come back to the issue of community and inter-country collaboration. Here, my suggestion is that we encourage and help WHO to fund the listening tour operational research, because the idea there is for the teams to collect information on the perspectives of communities located in the border areas on inter-country collaboration and viable strategies. With that information, WHO to a new inter-country collaboration strategies that are not whatever the people tell us, WHO and the partners on the way forward. But absolutely, we need to tap the resources at the community and listen to their perspectives on what we should do to improve inter-country collaboration going forward. Thank you.
Thank you very much indeed.
Bringing it all back to the community, which is really what this is all about, isn't it? And bringing us, of course, to the end of the power of partnership, defeating onchocerciasis. Thank you, Dr. Mamoun, and to the expert speakers on this session and throughout the symposium today. So many wonderful takeaways that have been shared, hoping that the social media team have been very active. Two of the catchphrases I know I'll be taking away: keeping up the hard working, making it look like a miracle. I thought that was absolutely brilliant. And being better ancestors, because that goes straight to the heart. And just to share David Ross's message about the chat, from the chat, about how wonderful the presentations were and how speakers have offered a lot of content that can be used for the future. David, I'll bring you in at this point, as I'm certainly not going to be the one spotlighted for taking up time. So for now, to everyone, stay safe and be well. David?
Oh, yes, the lovely world of virtual meetings. Oh, I so wish this meeting could have been in person. Listening to all of you share your experiences, your expertise, your lessons, this has been so gratifying. I just can't imagine how gratifying it would have been to have you all together and to see the rich history of these relationships flourish even more. But so be it. We've done the best we can. Thank you, Patricia, for marvelous facilitation today. And of course, I owe a huge debt of gratitude to our planning team. And their names here are on the screen, which in the view I'm looking at, I can't read. It's too small. So I want you to read those names. Be aware we thank each and every one for all the work they did. There's been an enormous amount of work that went into this. And of course, we have to thank Bruce for writing this book. It motivated me. David Addis introduced me to Bruce, took us out to dinner, and we talked, and we said, wow, this would be great. Let's use this as a way to talk about the history and propel us to the future. I want all the audience to know that the questions and answers will be eventually answered and posted on our website, but you can also reach out to me or my colleague Lisa Valente directly to get answers to any questions you may have asked that were not answered. I must say, I've been at the Task Force for Global Health for 21 years and been exposed to the rich NTD community through my colleagues. And given that, though, still today, I've learned so much. And I want you to know that the citizens of the world, all of you, our panelists and our speakers, the citizens of the world are indebted to your contributions, your persistence, your commitment, your expertise. We don't have any time, so I can't try to make some great wrap up, but I can say in the modern way things are done these days, we're going to produce a graphic that is a word cloud. And think about these words that we heard today: impact, accountability, funding, persistence, clear objectives, independent action and innovation, data-driven decisions, evidence, bold and compassionate leadership, country leadership and ownership, long-term support, maintaining momentum, rapid application of research, access and equity, independent evaluation, dogged support from the World Bank, evidence, innovation, documenting, as Frank Richards said, document the progress, document the science. Multiple funding streams are required. We must maintain the kind of compassion that brought this program to begin with into being and continued. words like science, surveillance, coalitions, evaluation, effective management, program relevance. I love this concept of listening tours. So many words I've tried to capture. We will put in a word cloud as a kind of a graphic to facilitate this, but just so you all know, we are taking your experience, all the documentation of today. We will be working to put that together into the kind of course and courseware that could be offered to the world to help you teach, those of you who are still teaching, to teach your students on the concepts of building partnerships and coalitions. We at the Task Force for Global Health will use it to teach our young staff, because I've come to realize we tend to accept that people just sort of are supposed to know how to do this. And what the lesson I've learned is it's helpful to be taught. So we know that success takes time. So we want to focus on the end goal. The job is not done. And my colleagues at the Mectizan donation program continually remind me that it is time to stamp out Onco. So with that, I want to thank you all for your experience, your expertise, your commitment. Please stay with us to finish the course. We've got a little ways to go before we're over the finish line, but thank you so much, and God bless, and stay healthy.
Under the principle of primary health care, under the principle of making sure that the communities lead, then we are good to go, to making sure that everyone is not left behind.
Ana bayar da maganin saboda a kawar da cutar kan ma yaran da suka taso su san ma akwai wannan cuta.
All you need is to help the communities. They will take their own conditions in their hands and solve their own problems.
Ce qui fait que faire remplir ces tâches quotidiennement, ça ne me gêne pas. Ça fait un plaisir de rendre service à la communauté.
Ensemble, nous pouvions éliminer l'onco.
Ensemble, nous pouvons éliminer l'onco.
Ensemble, nous pouvons éliminer l'onco.
They say, how did you do it? And I tell them it's just commitment. Commitment.
Together we can stamp out onco.
Together